The show Health and Wellness with Vassula Christodoulou is sponsored by Lexus Croydon. Get up to 10% off and 2 years free servicing on new cars when you quote Hellenic TV at Lexus Croydon. Book online today or call 0208 649 5919. Terms and conditions apply.
Καλώς ορίσατε στην εκπομπή Υγεία και Ευεξία και το σημερινό μας θέμα είναι τα εμβόλια του COVID-19. Φιλοξενούμενός μας είναι ο Δόκτωρ Γεώργιος Κασσιανός. Ο Δόκτωρ Γεώργιος Κασσιανός είναι ο επικεφαλής του προγράμματος εμβολιασμών του Βασιλικού Συλλόγου Γενικών Ιατρών και υπεύθυνος για το συντονισμό των εμβολιασμών. Του έχει μάλιστα απονεμηθεί από τη Βασίλισσα Ελισάβετ ο τιμητικός τίτλος του διοικητή της Βρετανικής Αυτοκρατορίας για την προσφορά του στην γενική ιατρική. Good evening, Dr. Kassianos. Thank you so much.
Good evening to you, Vasila, and good evening to your viewers.
Thank you, and congratulations for such a great achievement, Dr. Kassianos. We feel really proud for you. Thank you. Right, I would like to start from the first question about the vaccinations. Are the COVID-19 vaccinations approved by the Food and Drug Administration?
Well, the Food and Drug Administration, the FDA, is in the United States, of course, and they have approved already the Pfizer, the Moderna, and the Johnson vaccines, but not yet the ASTRA ZENECA. Why? The reason is that they are waiting for the United States trial of this vaccine. And today, they have actually announced the results. They haven't published them, but they have announced the results. And the results are just amazing, because what we have learned is that the AstraZeneca vaccine prevents us from getting infected with mild disease by 79%, and the older adults, that's the elderly, the over 65s, by 80%. And it protects us from severe disease by 100%. And of course, the big question was, what about clotting? Because as we know, Europe is talking a lot about clotting. Well, they had 32,500 people in the trial. They looked specifically for the special clotting in one of the veins of the brain that they found in Norway, and they said that it may be actually connected with the vaccine. In the whole trial, they found absolutely none. We haven't had any. So generally, at this stage, we can safely say that the AstraZeneca vaccine is not only very effective, but also very safe. So I'm delighted to have seen today the results of that trial.
Excellent news. We are so pleased to hear that. So, Doctor, when we say, it's an emergency use authorization, what does that mean?
Well, when you have an emergency such as the pandemic with the SARS-CoV-2 virus, there is an urgent need to approve things in a much faster way than what you normally do. And the FDA, as well as our MHRA, which is the equivalent. The MHRA here has actually approved vaccines, that's the Pfizer and the AstraZeneca and the Moderna, and they have given them this, what we call emergency authorization, which means that the vaccine is not licensed, or the drug is not licensed because they can do it for drugs, but because there is an urgent need for us to get the vaccine, they can give it the emergency authorization, provided they are very satisfied that the data they have is absolutely robust, nothing is missing, they have got all the data there, and the vaccine is, one, effective, and two, is safe. So when you actually satisfy those two conditions, you can actually get the emergency authorization, which is only really during the pandemic.
Okay, this is very interesting. And what safety and effectiveness data are required to be submitted to Food and Drug Administration for, what additional safety and effectiveness information are needed in order to pursue approval?
Well, the FDA will always want to see the phase 1, 2, and 3 data. Phase 1 is when you try it on just some very small number of volunteers. Phase 2 is when you tried in 100 or more people. But phase 3, you tried in 1,000 of people, like the one they have actually announced today. They have to see this data. They have to get from the pharmaceutical company all the safety data they have. Everything has to be put on the table. And sometimes they will actually stipulate how many, the number of cases that you must get during your trial before you stop your trial. For example, in the trial today, they had to have just under 100 cases of COVID. So they had to go on and on and on until people in the trial were infected, and there were 94 cases. Now, they can be in the real vaccine, they can be in the placebo. But as we found today, it's mainly the placebo that really falls ill. In addition to that, the FDA may also inspect the factory and make sure that everything is absolutely crystal clear before they give authorization. So it's a lot of things they do, but this is generally what they will do.
Yes, kind of procedure, that we have to follow. So the history of vaccine shows that delayed effects following vaccination can occur, but when they do, these effects tend to happen within 2 months of vaccination. First, is this true? And is this the reason that now we have to wait 12 weeks before we have the second dose instead of 3 weeks, I think it was initially?
Right. Let's separate the two.
Okay.
The 2 months is because every trial has to have a follow-up of a minimum 2 months. And that's what the FDA demands. Okay. Why? Because in those 2 months, you will get more or less all the side effects that you expect to get from the vaccine.
Okay.
And this is why the 2 months. Now, the 12 weeks instead of 3 or 4 weeks, what is that problem? Now, when a company has to produce a drug like a vaccine, they have to tell the MHRA what is the earliest time you can give the second dose if you need a second dose. In the case of COVID-19, we do need a second dose. Why? Because we have never come in contact with COVID, with the virus, with the SARS-CoV-2. And therefore, when you have never come in contact, you give 2 doses of the vaccine. From then on, you only give 1 dose. So that second dose has to be at an earlier stage, the earliest stage you can. And for the Pfizer is 3 weeks, for the AstraZeneca is 4 weeks. But what we found with AstraZeneca is that when they had the group of the volunteers that received the low dose of AstraZeneca, the second dose, which was a standard dose, they gave it to them at 12 weeks. And by allowing much longer, the efficacy of the vaccine went up the roof, 90%.
Oh.
Now, also in immunology, we do know that if you allow longer time, you get a much greater effect from your second dose. Here in the UK, we needed as fast as possible to vaccinate the 9 priority groups as fast as possible. And if we were to give them 2 doses, today, instead of 26 million doses to 26 million people, we would have given it just to 13 million. In which case we would have had a lot more cases and deaths happening in the UK, but we went straight in and gave it to 26 million today, in which case we covered very well a large number of the population. And as you know, the number of deaths, number of admissions to hospital, everything went right down. So what the decision was by the JCVI was the second dose to be given at 11 to 12 weeks. And that's exactly what we're doing now. We're bringing patients back at 11 to 12 weeks to give them the second dose. When I went for my first dose, which was back in December, they gave me the Pfizer jab, it was at the time, and they gave me an appointment for 3 weeks. And at that time, without the JCVI having said anything, I said, no, don't give me 3 weeks. Give me 8 to 12 weeks. It will do a better job for me than if I come back in 3 weeks. And they did. And I went 8 weeks later and got my second dose. So it's something that we have known in immunology, in vaccines, and we just applied this time. But nobody else in the world has applied, although a lot of the countries now are regretting not following that, because they could have really covered much number of the population and do a better job like we have done.
Yes, there seems to be a confusion about the order of the vaccinations between the clinics and hospitals, because on some clinics, when you book for your first, you have to book your second as well. But at other places, medical centers, they said, we will let you know. And people don't know what to do. I mean, why is this happening?
Okay.
If you are aware of it, of course, about these procedures, which I'm sure you are.
The centers can do it in a different way. First of all, let's say that the GP's computer system is a national system, and that is the one that takes all the information in. When you go to a vaccination center, there is another system called Pinnacle, and as soon as they put on the Pinnacle your details and you leave, they press the button and the information goes into the GP system, and that's where we can extract the information, which is wonderful, really, to have anything like this, where every second the government knows how many people have been vaccinated, which vaccine is so, because they can extract the information. No, some of the centers will actually give you there and then the appointment, because they want you to come back to them or the GP, but others leave it open that we're going to call you, and at that time we'll give you the most convenient appointment for you, where we are actually vaccinating at the time. So don't worry about it. You will hear from us.
Okay, because at the medical centers, they said, we will let you know, your GP will get in touch with you. When you get in touch with your GP, they said, get in touch with the place that you had the vaccine. So people are a bit confused, but as you said, we shouldn't worry and just wait till we hear from them. Right. Okay. We are also confused. I can hear lots of people saying about this leaflet given at the vaccination centers. And the leaflet is given to us after we have the vaccination. But it says, read all of this leaflet carefully before you receive this vaccine, because it contains important information for you. So why they do not give it to us in advance before we have the vaccination? This makes us feel a bit scared. Or why then don't they give it to us before? Or can they post it? I know perhaps it's for them to save time, but they can post it like they're posting so many other things to us.
No, I can't really speak for the nation, but I can tell you what should happen. When you come for vaccination, and we ask you for your consent to get vaccinated, you must take you must give us an informed consent, which means you know all about the vaccine that we need to tell you, and then you say, okay, yes, I would like the vaccine. Now, here, there is a leaflet which normally should be given to you in advance.
Okay.
In my case, I was actually given the leaflet which the pharmaceutical company actually publishes for patients. And my wife was given hers. So this is actually what you should be given before. Once you have your vaccine, you'll be given one of these two. It doesn't matter which one, but it tells you what happens after vaccination. So that's what should have happened, but I don't know what happened in the cases that...
Yes, they just give a paper with, a few things, but people, have to say they get concerned because also they try it's like a trick, they don't want us to have it before. So, but it would have been better if we received everything, as you said, in advance. Okay, what stops the body from continuing to produce the COVID-19 spike protein after getting a COVID-19 vaccine, the mRNA or adenovirus, if I pronounced it correctly? So what happens if our body continues, again, two separate questions, what happens if our body continues to produce the COVID-19 spike? And what are the symptoms and what can we do about it?
Okay, so first of all, our body does not produce this spike, the S, that big protein, that what our body does, it actually forms antibodies against it to immobilize it. So this is what happens when you actually get infected with the SARS-CoV-2 virus, usually through your respiratory tract. Now, the virus that goes into your respiratory tract and finds your cell, and it uses that spike to lock into a receptor in your cell called ACE2. Once it locks in, it opens the cell and it can get inside. Job done. At that point, it instructs your cell to produce its own babies. And you produce lots of viruses in your own cell. And this is where the mutations can happen, because thousands and millions of those little babies are actually produced by your own cells. Okay, so what the vaccine does, it actually uses the messenger RNA, in the case of Pfizer and Moderna, or the chimpanzee adenovirus, which causes cold in chimpanzees, but doesn't cause anything for us, and they attach that spike protein only to the adenovirus or to the messenger RNA. Those then, once injected to your arm, will take the spike protein to your immune system, and the immune system sees it and produces antibodies against it to immobilize it. Okay, so generally it's like that. Now, what will happen to the adenovirus and the messenger RNA? They decay, they just die. The adenovirus, it has lost the ability to produce itself because they have removed that part of the virus. So it's there and it will die. Within about 2-3 days, they both decay and go. So we produce antibodies against the spike protein. We don't produce spike protein. It's the virus that has the spike protein.
Okay, so there's nothing to worry about this then, which is great. Can COVID-19 vaccines change the DNA of a person?
No, absolutely not. They will not change our DNA. They will not affect our fertility. They will not do anything like that. What they will do is to stimulate our immune system to produce antibodies. And of course, those antibodies are the antibodies that will actually kill the virus if we ever came in contact with. But there is another kind of antibody, which is the memory, the B cells. And they retain the memory of what that spike was. And if there was ever an attack to the body by the real virus, they remember that spike and immediately they throw out the antibodies to immobilize the virus. So it's a very clever system.
Very interesting. And it's nice to hear this from you, Dr. Kassianos. Do we know if any of the COVID vaccines contains live virus?
The short answer is no no live virus in the final product that is like with other vaccines. What here you have, not the messenger RNA, because it has nothing to do with anything live. In the adenovirus, the ASTRA ZENECA one, the virus is live when it gets in, but it has lost its ability to multiply because they have removed that part of the virus that makes it multiply. And therefore, once it takes the spike to our cells and the immune system recognizes the spike and so on, from then on, it decays and is dead. So yes, it's live, but it's not able to do anything. They cannot replicate, they cannot multiply.
Okay, that makes sense. It's much clearer now. Are COVID-19 vaccines made in fetal cells?
Right. Now, this is actually a good question, and it only concerns the ASTRA ZENECA.
Okay.
First of all, I can tell you that there is no fetal material present in the vaccine. Let's start from that. But what the person that asked the question has in mind is that in 1973, in Netherlands, a scientist there took cells from a kidney of a fetus. And he modified them, and he did some modification to it. And the cells then were immortalized. They never die, and they multiply. And on them, they can actually grow the adenovirus.
Okay.
So it started in 1973 from a kidney. Yes, it was from a fetus that was taken, but it was bioengineered, if you like. It was changed, and it was made in a way that is the best way to actually grow that virus. But our vaccines contain no fetal material whatsoever.
Okay, that's good to know. Does the COVID-19 vaccine cross the blood-brain barrier?
Right. The answer is no. There are two things here. The vaccine will produce antibodies that is in the blood. And anything that goes in the blood and the tissues that it supplies will actually sort out. But the SARS-CoV-2 that causes COVID-19 is when it actually circulates, it can actually affect the brain, the liver, the kidney, and very badly, of course, your lungs and your heart and so on. And one of the symptoms we get is actually the brain fog, as they call it. Now,
yes.
Does it actually move into the brain from the blood, the brainstem barriers, we call it? In humans, we have not shown that to happen. What we have shown is in mice. And probably the person who asked this question read something about the mice. And that's basically why the question was asked. But no, at the moment, we don't know whether it crosses the brainstem barrier. But what we do know, it does affect the brain. And the brain fog can be also one of the symptoms of long COVID. Long COVID is when 12 weeks, 3 months have passed, and the patient still has symptoms of COVID. It can be the fatigue, it can be the brain fog, it can be anything, loss of taste and so on.
Yes.
That we then call long COVID. Now, one of the anecdotal, and it's definitely anecdotal evidence we have today, is that vaccination can actually help people with long COVID. Now, we need studies to show that, but that's anecdotal, but it's what we know today. So get your vaccine, and above all, do not get COVID-19, and vaccines can actually enable you that.
So are you actually saying that the vaccine can help, like the side effects of the COVID-19, like to recover, because lots of people are suffering with lots of side effects when, after they had the COVID-19. So is this possible?
No, we don't say that. Once you have COVID-19, your body is coping, is trying to cope with the infection. So the vaccine has nothing to do with that. The vaccine is the one that will actually prevent that virus giving you COVID-19.
Okay.
And today we see for severe disease, for you to be admitted to hospital, go on the ventilator, or die, we know from the today's study in the United States, 100% prevention from the ASTRA ZENECA. That's absolutely amazing.
Excellent. This is so useful, Dr. Kassianos. Now, another question. Why women were told to wait a month after getting the COVID-19 vaccine before getting a mammogram?
Right. This is a good question. And it stems from the fact that whichever vaccine you have on your arm, it will transfer the material into your the immune system. And it does that, among other ways, through the lymphatics, the glands you have in the armpit.
Yes.
And those glands can get bigger. And of course, you have got glands here, and they can get bigger. And the radiologist actually sees the breast, but sees also swollen things. And of course, is the lymph nodes from the vaccine. And this is why some will advise not to have that.
Exactly.
My advice is have your mammogram. Don't delay it, because it's very important that if you have cancer of the breast, it's found as early as possible. But tell your radiologist that I had my vaccine on such and such a date. Now, the Mayo Clinic in the United States, they do not suggest that you wait at all, that you have your mammogram when they call you.
Okay, yes, this makes sense, actually, and thank you for elaborating this. Another thing is how long a vaccine immunity lasts. Perhaps we don't know yet exactly, but just to give us an indication, is it like for 4-5 months or a year? And what do we do next year? Do we need to have the vaccine again?
Well, we have started doing on volunteers vaccinations from last April. So you can only say up to March 2021, that's 11 months. They know now whether there are still antibodies in people who have had the vaccine. They haven't published anything because I haven't seen a paper, but we will be seeing now a paper as we go towards July, when the phase 3, that is to say in the thousands of people studies actually took place. The suspicion is that the vaccine may give longer lasting antibody than the disease. So we don't know, nobody knows, because we haven't had the time to see, but we think that they're going to actually last for some time. Now, whether there will be enough to be able to counteract an infection, we don't know, because there is what we call a protective level of antibody, above which it protects you, but below it doesn't, because it's too low. And we don't yet know what that figure is. We're trying to figure it out, but we need some time. So take it that it's going to be for months, but we don't know for how long.
For how long? Excellent. Okay, and one last question, because we are running out of time, but hopefully we will have you again soon to answer many other questions. Now, the Centers of Disease Control and Prevention has indicated that we can take anti-fever or anti-inflammatory medication if necessary following COVID-19 vaccination. But what we should be aware that doing so could diminish the level of immunity that develops. So it is better not to take this medication. Therefore, how long should we wait after vaccination before taking these types of medication?
Okay, we need to go back to some years ago when Professor Pedula in the Czech Republic did a study in little children and found that paracetamol reduced a little bit the number of antibodies that were put out.
Sure.
Nowadays, when the children have their meningococcal B vaccine, with the infants, we actually give them paracetamol on purpose. And we don't mind any reduction because the reduction is so small that it doesn't really matter.
Okay.
ASTRA ZENECA did check whether paracetamol will affect the vaccine, and they found no affection of the vaccine. My advice is do not use ibuprofen naproxen, anything like that, the anti-inflammatory drugs, for anything that you get from the vaccines, use the paracetamol. But in full dose for an adult is 2 tablets 4 times a day. If you're taking less than that, don't expect it to work. 2 tablets 4 times a day, paracetamol. Once you get a headache or the pain or joint pains or anything like that or fever, it's fine. But at the same time, really think hard at what point you should be asking your GP if what you're getting is due to the vaccine or something else.
Sure, but it's not necessary that we have to take something. I mean, if we can bear with the pain or, the fever, etc., it's not a must, of course.
Absolutely. And also, many of us will not get any problems. I only got a little bit of soreness on the arm there and nothing else, no other symptom. But a lot of people will actually get other problems. And about 10% of people, 1 in 10, will actually get some fever. So that's fine to take some paracetamol. Within a day or 2, you find actually things do get better. But one warning that the MHRA has just given is that if you have a headache for 4 days and it continues, then you need to ask your GP for advice, because they said that because of what they found in Norway about that thrombosis in the vein that brings the blood out of the brain. And also, if you get any bruising anywhere else other than when the vaccine was given, also report it to your GP.
Sure. Thank you so much, Dr. Kassianos. It was a great pleasure having you today. And we hope to have you again very soon, because your information is valuable to us. Thank you.
Anytime.
Thank you so much. Thank you.
Bye-bye.
The show Health and Wellness with Vassila Christodoulou is sponsored by Lexus Croydon. Get up to 10% off and 2 years free servicing on new cars when you quote Hellenic TV at Lexus Croydon. Book online today or call 0208 649 5919. Terms and conditions apply.